Our first speaker, Mr. Tapan, has over 30 years of national and international experience in the healthcare industry in India and UK. Mr. Ray is the Director General of the OPPI and has held several senior positions in international marketing at Glaxo UK and has been a director on the board of Glaxo India. He has also been the Managing Director of Abbott Laboratories India Limited. Mr. Ray also holds the position of Independent Director on the board of companies located in India and abroad and is a visiting faculty in India's top management institutes. Mr. Ray holds a BSc Honours and a Master's degree in Geology from the University of Calcutta and has trained at the IIM Ahmedabad. Mr. Ray will deliver the welcome address and opening remarks. Please give a warm round of applause to him.
Good morning, ladies and gentlemen. Welcome you all to the second OPPI Access Seminar, and which we started last year. And I thank you all for your presence here. Special welcome goes to all the speakers of this seminar, and especially the senior government officials and the media present here. Before I start my brief opening remarks, in the context of my presentation, let me confess three things. Number one, I am a born optimist. Number two, I don't live in a world of gloom and doom, and I find hope in every despair. With this, when I look at the access and search for the definition, I found one, the United Nations Development Group's definition. It says having medicines continuously available and affordable at public or private health facilities or medicine outlet that are within 1 hour's walk from the homes of the population. So if we apply this definition to India, India may not be perfect, and perhaps far from perfect. But the situation is not that bad either. And that I found when I was going through a data of McKinsey on household consumptions in India. And if you look at this data of household consumption, and if you look at healthcare, you will find that healthcare consumption in 2005 used to rank number 5. And in 2015, it will be 4. And in 2025, it will be 3 out of all healthcare consumptions. And CAGR will be 9, and it will be next to education and recreation. So the progress that we are making cannot be just wished away. And in this progress, if you look at the healthcare sector, at sectoral breakup, there pharma plays a dominant role. It's next to hospital. This is IDFC Securities' study. So pharma is extremely important in the healthcare field next to hospitals. But when we look at overall healthcare spending and compare it with OECD countries, we find that in OECD countries, the maximum spend is through the government, through public. But when we look at Southeast Asia, here, except perhaps Thailand and Indonesia, in most of the countries, the healthcare sector is being driven by private players. And what is the, this is not bad. This is not bad in any way. But it has its ill effect. And what is that ill effect? That when private healthcare sector dominates and public healthcare sector is not that efficient, then people are pushed to go and avail the facilities of private healthcare sector. As a result, what happens is you will find this is one of the latest Lancet study. It says the out-of-pocket expenses, because of this reason, is one of the highest in the world, and in our region, it's next to Pakistan. So if we want to ensure that out-of-pocket expenses come down, the country will have to ensure that more number of patients avail public healthcare facilities. That will not necessarily mean that private will have no role. Private will continue to have a very, very significant role. Now, in this direction, whether our country is progressing or not. And if we find, and perhaps more data will be presented by IMS, because you will find that after National Sample Survey 2004, we don't have much data. But the study which will be presented by Amit Bakliwal, you will find that they have updated most of the data, and most of the data will indicate that there are areas of improvements, maybe significant areas of improvements, but there are many areas where the country has made significant progress and which cannot be ignored. And some of the things which has happened in India, which perhaps you are well aware, but it's worth recapitulating. National Rural Health Mission, there may be criticism against that, but it's working, and we have a senior official from Ministry of Health, and in his presentation, I'm sure he will deliberate. Now we have got National Urban Health Mission, and now both have been clubbed, and now it's called National Health Mission. Rashtriya Swasth Bima Yojana, a fantastic initiative. Perhaps you will recall in the last year's Access Seminar, the success of this scheme was highlighted by a private player. Universal health coverage, it has not been implemented. It's still in the drawing board. But when the country has increased its expenditure as a percentage of GDP to 2.5% for healthcare, this perhaps will see the light of the day. I understand that this free medicine distribution from government hospitals and nursing homes will be rolled out soon. And now it was planned, the 16,000 crore was planned for 5 years, 2 years have gone, and you will hear from the senior officials from the Ministry of Health that this will be implemented, that 16,000 crore perhaps will be spent in 3 years. And one can well imagine the impact of that also can't be wished away. Along with that, there will be centralized procurement system, what I understand from Ministry of Health. So there they will prefer either Tamil Nadu model or Kerala model or Rajasthan model, one of this, and states will get lots of discretion there for purchase, but it will be centrally, whether it's central purchase or state government. Because of the increase in GDP from 1.2 to 2.5%, many things will start happening today despite doom and gloom. We have seen that smaller private healthcare players, they have started penetrating in tier 2, tier 3, tier 4 towns with more affordable healthcare to improve access. Health insurance, if you remember last time's data and the data that I have, that's also growing fast. May not be as fast as we would expect to, but definitely it's growing at a fast rate. Microfinancing, especially in rural areas, for healthcare is increasing, and this microfinancing is helping, especially the hospitalization of poor. Telemedicine, we may not keep tab of that, but telemedicine with the encouragement of ISRO and the launch of various satellites, that's also gaining ground. And telemedicine also will reduce the cost. At the same time, because of public-private partnership, more number of mobile diagnosis and surgical centers coming up, and this will reduce the travel time, especially of the rural people, to avail the health facilities. More about that in course of the day. You will get to know from various speakers. I just wanted to set the course, and I'm sure you will enjoy the proceedings of the day. Thank you.
Thank you, Mr. Ray, for outlining so nicely,